Can we talk about periods and how they change over time? People are often uncomfortable speaking about what's down there or genitalia.
As a GP, we look beyond how the period is impacting you. There's lots of myths out there, and I think it really makes people worried about whether what they're experiencing is normal or not.
It's an interesting area because it sounds like every woman is different with this. I think of my mum, for example. That would mortify her to use these kind of words, but that's okay too. Is a GP usually comfortable to do an exam?
It's really hard to talk about these really intimate things. Sadly, a lot of women feel that having heavy and painful periods is just part of life. And I think we have something to do to get out there.
Hello and welcome to AXA Health Chats. I'm Jan Vickery. I'm Proposition Lead here at AXA Health, and I'm joined today by my colleague Dr Nikita Patel, who is Head of Propositions and also a GP. So today we're going to be talking about women's health and in particular menstrual health.
So should we talk a bit about what a normal period is?
That sounds good, yeah.
So everyone has hormones in their body. So things like estrogen, progesterone, testosterone, and these are little signaling systems for bits of our body to tell them to do things. For periods, we get changes in our estrogen and progesterone, and that's what causes a period. So in general, estrogen will rise, and as you ovulate and release an egg, you will release progesterone. And then as this drops, that's what causes your period. So this usually happens on a 28-day cycle. But for people, it can be very, very different. So some people might have a period every 3 weeks, and other people every 6 weeks. And these are all variations of normal. A period could last a couple of days, or it could be 7 or 8 days. Again, completely normal. Some people tend to have very light periods, and some people have heavier periods. And it's really important to know when something is not within those normal bounds. So often I'll get people asking me about, well, I think I have a heavy period, but I don't know. If you're changing your pad every hour, or you're flooding, so that means that you're going through your clothes, or you're having to use a tampon and a towel at the same time, these are all signs of you're getting very, very heavy bleeding. And people come to see me as a GP from finding out what is normal. Is their anatomy normal? Are their periods normal? All the way to abnormal. So they may have very heavy periods or painful periods, or they might have very long periods, bleeding in between periods or after they've had sex. So there's lots of really broad spectrum of things that people come in for.
And from speaking to patients, what do you think patients worry most about in preparing to come to see you?
It's a really hard thing. There's so much information out there online, and there's lots of myths out there. And I think it really makes people worried. But also, I think some people feel really worried when they're on their period and they're expecting to be examined, and they apologise so much about, oh, I'm really sorry I'm on my period, or I'm bleeding, or sorry I haven't shaved down there, or I'm sorry if it doesn't smell right. The thing is that there's so much variation of normal that, and as a GP, we don't care. We don't worry about smells. We don't worry about what it looks like down there. More often than not, we don't even notice if hair is there or it isn't there. But I think, people worry about a lot of things, but they really shouldn't, because the key thing that the GP wants to do is to identify, is this normal or not, and relieve anxiety if it is normal. Or secondly, to help somebody if they are experiencing difficulty with pain or with excessive bleeding, then to help them with some investigations to make them better.
And what, for someone who is wondering whether their discomfort or pain during a period is normal, have you got any steer on whether someone decides they should come and speak to a GP?
You know, pain is a really subjective thing. Often your GP will ask you, on a scale of 0 to 10, 10 being the worst pain you can possibly imagine, where would you put that? I'd say in general, if you're not able to carry on your usual daily activities, so if you're having to take time off of work, take time off of school, miss things that you would normally do, then that's probably a sign to see somebody. And there are lots of things that GPs can do. So they could offer, sometimes of pain medication, they can offer other types of medication, even contraceptives to help with bleeding. It's really funny because patients will always come with different names for down there, or they'll look down there, and they feel really uncomfortable talking about it. The thing is, there's a lot of different anatomy down there, and knowing exactly where the problem is really helpful from a medical perspective to be able to understand some of the symptoms and the signs that people are talking to you about. So from a broad perspective, what you can see on the outside, that's your labia. So anything that's happening around there, so in terms of could it be itch or redness or inflammation, if it's swollen or something like that, these are all things that you can see on the outside.
Yeah.
There's a canal that goes from your womb, which ends in your cervix, all the way to the outside. And that's the hole where perhaps you might put a tampon inside or something like that. That canal is your vagina. The hole itself is your vaginal opening. There are things then within that broader anatomy that we could also look at, but knowing on a very broad level as to whether it's your vagina or your labia is really helpful. I think if you're feeling uncomfortable about saying any of these words to your GP, or you're not sure if what you're saying is right, it can be embarrassing, and some people find it really, really difficult. So being able to point to it if the GP is examining you, and making sure that you and your GP are talking about exactly the same thing. So ensuring that they understand. So if they are examining you, to show them exactly by pointing, well, this is where I think the problem is. That can be really, really helpful.
And have you noticed that there's a bit of a generational thing with how people talk about their vaginas and labias? Younger generations seem much more comfortable, and I think the schools are doing a lot to destigmatize talking about your bits.
I think that's right. I think that the destigmatization of these anatomical words is so incredibly important, and knowing that schools are doing it, but also, it's really about clear communication. These aren't embarrassing words, they're anatomical words, but it's really breaking that stigma down across society.
And presumably also there will be, I think of my mum, for example, that would mortify her to use these kind of words, but that's okay too.
You have to be able to trust the person that you're talking to about this very intimate issue. And if you're embarrassed about saying specific words, I think it's really important from a GP perspective that you've got time, that you're making it comfortable for somebody to open up. You might need more than one appointment if you didn't feel comfortable enough in the first appointment to open up.
And that leads on to another question, which is, without a doubt, many women feel much more comfortable seeing a woman GP, but often have guilt around that because you just don't feel that you have that connection with a male. Is that something people should be worried about? How does a GP practice feel about patients requesting a female GP, for example?
As a GP, I'd want my patient to feel comfortable. And so many women are really comfortable seeing male GPs or male obs and gynae doctors, but some women don't. I think if you don't feel comfortable, then it's within your right to request to be seen by somebody that you feel comfortable with.
And is that quite a common thing, or are you sort of being a bit difficult if you do that?
I mean, from my experience, I think it perhaps varies across different ages, different backgrounds, different ethnicities. But the key to making anything better in this respect is that you have to have a relationship and that you have to feel comfortable. If you're not going to feel those things, it's really hard to talk about these really intimate things.
And if somebody sees their GP and feels that either they weren't comfortable or perhaps weren't even brave enough, is it okay then to have a redo and perhaps with having thought through and having been through the first experience, is that something that you see happen?
I do sometimes see that happen. So sometimes examinations can be difficult, where somebody may have come in to see me for a period issue, but they weren't prepared that they were going to be examined. I'd ask them to book a follow-up with me. Sometimes my male colleagues have seen somebody for periods and the patient hasn't felt comfortable having the examination, and they've asked to book follow-up with a woman GP. These things are all very, very normal.
Yeah, okay. And just to come, you mentioned it earlier, but if you're on your period, is a GP usually comfortable to do an exam?
Yeah, absolutely. There are specific situations where you might not want to examine. So, for example, if you're looking at somebody's cervix, or you want to take a sweep of their cervix, so that means a little kind of sample of their cervix. You don't want to do it during their period because it might affect the result.
Yes.
But we wouldn't feel uncomfortable seeing someone who's on their period.
Yeah.
People really feel really, really embarrassed, especially if they're towards the end of their period or they're just coming on.
I think people often have this worry that you wouldn't be able to see anything for the blood, if you know what I mean.
Yeah.
But that's not the case.
Well, there are different parts of the examination. So, for example, part of it would be inspecting, so having a look down there to see if there's anything out of the norm. That might involve an internal examination with a speculum, which kind of opens up the vagina so that you can have a look inside, having a look at the cervix, which is the opening to the womb. That would probably be a bit tricky if somebody's right in the middle of their period, because there might be a lot of flow. But what it doesn't stop us from doing is an internal examination. For example, we might put our finger inside the vagina to have a feel of the cervix and to have a feel around the sides of the cervix. By doing things like that, we can look for fibroids and for endometriosis and things like that. So we might not be able to do everything, but there are things that we can do.
Nikita, what can a GP help with when someone comes to see you that's beyond examination? What's in your arsenal as a GP?
So we'd do a broad range of things. So if somebody was coming to me, for example, with heavy and painful periods, we'd perhaps do the examination, examine their tummy as well, but also ask about wider symptoms. So about things like, have they noticed any changes in their weight or their heat tolerance or something like that? Because actually your period changes can be related to your thyroid. So we might organise some blood tests as well. The blood tests will look at, are you losing too much blood, which is making you anemic, but also things like your thyroid test. Often if we're looking for things like fibroids or cysts, like ovarian cysts or something like that, we might request an ultrasound scan. So that's a jelly scan that women have when they're pregnant. And that can often give us some really quick answers from a primary care perspective. There are some things that we perhaps can't always manage within primary care. So things like treatment for very large fibroids that are making people symptomatic, so giving them very heavy periods, that you would need a gynecological referral for. Another condition that is talked about a lot more recently is endometriosis.
Yeah, it would be great to know more about that. How is that diagnosed? What are the symptoms?
I think in the UK, on average, it's it takes around 7 to 8 years for a person to be diagnosed with endometriosis. And there are lots of factors that contribute to this very late diagnosis. Endometriosis affects 1 in 10 women, so a huge proportion of women, we think. And a lot of women are probably still undiagnosed in the population. It can give you heavy periods, very painful periods, painful sex. It can give you changes in your bowel movements, so frequency of bowels, so opening your bowels very often, or blood in your bowels, or making you constipated. So there's a huge variety of symptoms. The reason for that is where usually you would find your womb lining inside of the womb, in endometriosis, this womb lining grows in other parts of your body. So that might be on the outside of your womb and growing to the nearby structures. So that's why it would be affecting your bowels. But it could really be in any other parts of your body. The really interesting thing about endometriosis is that people don't seek advice sometimes, because going back to what we were talking about before, about what is normal, sadly, a lot of women feel that having heavy and painful periods is just part of life. And I think we have something to do to get out there to say, actually, if you can't do what you would normally do in life, it's not normal and you really need to seek advice.
How is endometriosis treated?
It really depends on the level of endometriosis that you have. But it would usually be, well, firstly, it can only be diagnosed through an operation called a laparoscopy. So it's not like other conditions, for example, cysts and fibroids and sexual infections, where you can maybe do a swab test or some imaging. You actually have to look inside.
So it's a physical seeing it.
Yep, it's a proper full-on looking in your abdomen to look if there is any endometrium growing in places where it shouldn't be, and then taking a biopsy of that and confirming that it is this, and that's how somebody will get a diagnosis of endometriosis. It can be treated through sometimes very conservative measures, so things like painkillers and medication to support very heavy bleeding, or you might need surgery. So it's really a big spectrum.
I've certainly seen a lot recently. There seems to be a lot of people talking about PMT, PMS, PMDD. What's the difference? How are they diagnosed?
Yeah, so PMS or PMT, which you may have heard of, stands for premenstrual syndrome or premenstrual tension. These are a collection of symptoms, or some symptoms that people may feel before their period is coming on. PMDD stands for premenstrual dysphoric disorder, and that's often a constellation of symptoms that people might have in PMT or PMS that are really significantly affecting them and causing disruption to their life. So in terms of some of the symptoms that people may experience, these are related to the hormone fluctuations that we were previously talking about. So it would be around, some people feel very anxious or stressed or irritable. They might get breast tenderness or bloating. If you're worried about any of those symptoms, then it's definitely worth going to see your GP. And you could also have a talk with them about, well, where is normal and where is it affecting your life, where it's not perhaps normal. And that can help them to distinguish between PMS and PMDD.
And how is PMDD diagnosed then?
So there's a number of diagnostic criteria. So it depends on whether you have a certain number of symptoms. And if you have a certain number of those symptoms, then you would be diagnosed with PMDD. However, there is lots of treatment that spans both. So things like making sure you get a good night of sleep is really, really important. Reducing your stress and anxiety levels can be helpful. Regular exercise, eating well, all of these general lifestyle habits can contribute to helping those symptoms. Typically, a period will start for a girl around the age of 12. That's not to say that they can't start a little bit earlier, and often I do see girls where they have started a bit earlier. And by the time they're age kind of 16 to 18, they're likely to have been getting into a cycle of relatively regular periods. As time progresses, you will then have regular periods, and around your kind of mid-40s, you might notice that your periods are changing in regularity or changing in terms of how much or how often you're bleeding. And that can sometimes be a sign of perimenopause. As your hormone levels reduce over time, your periods will eventually stop. And that's when you've entered the menopause. Perimenopause is a really interesting thing, and there's lots of information about the perimenopause at the moment, and a lot of thinking that, it perhaps starts even a little bit earlier than your mid-40s for many women. And typically from a GP perspective, we would have asked around whether you're having any hot flushes or whether you're getting any dryness around your vagina, or whether you're getting any night sweats. But we also know that now that women are experiencing a whole lot more symptoms than that. Things like brain fog, joint pain, lots of things that are affecting them across their whole health rather than these very specific symptoms. So if you do think that that's happening, then it's definitely worth seeing your GP.
How is that typically, can that be treated, and how can that be helped?
Yeah, there's no specific test that will tell you that you definitely are in the perimenopause or you're not. We'll often go by what symptoms that you're having. In terms of perimenopause and menopause, sometimes a trial of HRT, which stands for hormone replacement therapy, can be really helpful. And there are lots of different forms in which that can be given. So it can be given as a tablet that you swallow. It can be given as a gel that you rub in, even a patch. Some people choose to have a coil put in. So for example, it's almost like a little T-shaped rod that can be, it sounds massive, but it's tiny. It's really, really, really small, that can be inserted through the cervix into the womb. And for many women, that can relieve all of their period problems that they're having, in terms of it can completely stop all of their periods, which can be really comforting for people where they're having a lot of irregularity and unpredictability with their periods. And it often gives them contraception at the same time and can take them through the whole of that perimenopause and menopause.
It sounds like every woman is different with this, and there's so many different solutions that can be discussed with a GP.
Yeah.
Now.
And I think actually with the menopause, and the perimenopause, this is where it is absolutely really important to think about what things are affecting you. Your GP really needs to understand that, and you need to work on that together. And whilst there's medication, there are other things from a lifestyle perspective. So some regular exercise can be really, really beneficial.
Isn't it funny how lifestyle comes back again and again and again, no matter what the condition is? And
that's where building those habits really early on, in your 20s or 30s is so important. It's so hard, if you're working and you have a family and you have kids, so many things to juggle. But integrating something into your lifestyle, whether that's walking to the station or having a weekly walk with your family or something like that, it can be really, really beneficial. That really helps so many things beyond just your menopause. I think so many different things work for different women. I think firstly, it's about having the confidence to perhaps talk about it with your friends. If you're not confident about talking about it with your friends, then booking that appointment. Having a clinician that you feel comfortable talking to and not being worried at all about saying the wrong thing, using the wrong words, being worried about what it might look like down there, what it might smell like. It really doesn't matter. I think sometimes people do find it very helpful to write down a diary. There are lots of apps as well that help you to track your cycles. That can be really helpful. And when we're asking for a very detailed history with what exactly happened with your periods, it can be really helpful. Sometimes your GP will ask really specific questions about when was the first day of your last period? How many days was it between that period and another period? How long has it been going on for? Did you have any other symptoms? And so however you track that, it can be helpful when you go in and see the GP.
And I've certainly heard from many women who feel that they've plucked up the courage to speak to a GP who they felt dismissed their worries, but they still feel deep down that they're not right.
Yeah, you've absolutely just got to go back again.
Yeah,
because
just keep going.
If your concerns and your worries haven't been alleviated, there's something that's not right, and it might be that the doctor listened and all the right things were done, but you haven't understood why this is normal, and perhaps that needs some clarification. Or it might be that your doctor has missed something, or you didn't have an opportunity to say it, or you ran out of time. All GPs are trained on making sure that we understand what people's ideas are about the conditions that they've come in, what their concerns are, what their expectations of the appointment is. So if those things haven't been addressed, then I think it would be very valid to go back.
Good to know. Yeah. Great. Thanks so much, Nikita. It's been so interesting today. We've covered a lot. We've started with what a period is, what's normal, what a woman can expect. We've also spoken about some of the challenges that people experience. And hopefully the one thing that people will take away from listening to this is the confidence to be able to know when to reach out for help and when to seek advice from their GP. So thank you.
Thanks for having me, Jan.
Nikita, sorry. We've got to have one blooper.